I think there's a widespread recognition now that we need to do things differently, to re-engineer the way in which the system works. Too often I think people find that it's dysfunctional, that people often at a very vulnerable moment fall through gaps between different organisations. We've ended up investing a lot of money in acute care, repairing damage as it were once it's already done, but not nearly enough attention on preventing ill health and preventing a deterioration of health. But I think the really exciting thing in Cornwall, which I think is really groundbreaking and leading the way, is this collaboration between the voluntary sector and the NHS and social care. And I think it recognises that the state can't and shouldn't try and do it all on its own. It's about a collaboration between community, families, individuals, and the state offering crucial support. Very strong believer in the NHS, but it has to be that collaboration between the wider community. And I think what you're doing here is immensely inspiring, actually. I've been so impressed this afternoon listening to great leaders locally talking about how they're changing services and the impact that it's already having in the areas where they've done this. So I think my job is to try and change the system to encourage this sort of wonderful experimentation and development of a new way of doing things rather than the centre always blocking things. I genuinely want to congratulate everybody who's been involved in this. When I encouraged local areas to come forward to become pioneers, I didn't really have any idea about the level of interest that there would be, but 99 parts of the country came forward with expressions of interest, and Cornwall worked its way all through that to emerge as one of the 14 pioneers. And that's something I think for people in Cornwall to be very proud of, but the leaders here are leading by example, and I'm enormously grateful to them for the work they're doing.